Hello and welcome to Health Tips TV1. Did you know that stroke can happen to anyone, young or old, and most cases are preventable? Welcome to Health Tips. Today, I'll explain the main causes of stroke, the types, how to prevent it, and what to do if stroke has already occurred. Now, my people, let us begin by clearly defining what stroke is and how it affects the body. A stroke is a serious medical condition that occurs when the blood supply to part of the brain is suddenly reduced or completely blocked, or when a blood vessel in the brain bursts and bleeds. The brain depends on a constant flow of oxygen-rich blood to function properly, and when this flow is interrupted, brain cells begin to die within minutes. This damage can affect vital functions such as movement, speech, vision, memory, and thinking, depending on the area of the brain involved. Stroke is a medical emergency, and the faster a person receives treatment, the greater the chance of survival and recovery. Without timely care, stroke can lead to permanent disability or death, which is why early recognition and prevention are extremely important. And now, let's take a closer look at the most common types of stroke that occur in human beings. 1. Ischemic stroke. This is the most common type of stroke. It happens when a blood clot blocks a blood vessel that carries blood to the brain. Without enough blood and oxygen, brain cells start to die, which can cause weakness, speech problems, or vision loss. Type 2 Hemorrhagic stroke. This occurs when a blood vessel in the brain bursts and bleeds into the surrounding brain tissue. The pressure from the bleeding damages brain cells and can cause severe headaches, vomiting, or loss of consciousness. High blood pressure and weak blood vessels are often the main causes. Transient ischemic attack, TIA, a mini-stroke. A TIA happens when blood flow to the brain is temporarily blocked, causing stroke-like symptoms that disappear within minutes or hours. Even though symptoms go away, it is a warning sign that a major stroke could happen soon. Immediate medical attention is crucial to prevent a full stroke. Cap for cryptogenic stroke, optional, less common. This type of stroke happens when the cause is unknown, even after tests. It may be related to hidden heart problems, blood clots, or small vessel disease. Doctors usually focus on preventing future strokes through medication and lifestyle changes. All these types of stroke have certain factors that can cause them. Let me explain 10 common causes and how each one can lead to a stroke. Cap 1. High blood pressure, hypertension. High blood pressure puts extra strain on blood vessels, making them weaker or narrower. Over time, this can cause vessels to burst, hemorrhagic stroke, or get blocked, ischemic stroke. Cap 2. High cholesterol. Too much cholesterol can cause fatty deposits in blood vessels. These deposits narrow the arteries, increasing the risk of blood clots that block blood flow to the brain. Cap 3. Diabetes. High blood sugar damages blood vessels and nerves. This increases the risk of clots and vessel rupture, making stroke more likely. Cap for smoking. Cigarettes damage blood vessels, increase blood clotting, and raise blood pressure. These changes make both ischemic and hemorrhagic strokes more likely. Cap 5. Heart diseases. Conditions like irregular heartbeat, atrial fibrillation, or heart failure can cause blood clots to form in the heart. These clots can travel to the brain, causing an ischemic stroke. Cap 6. Obesity and lack of exercise. Being overweight and inactive can increase blood pressure, cholesterol, and diabetes risk. These factors together make blood vessels more prone to blockage or rupture. Cap 7. Excess alcohol consumption. Heavy drinking raises blood pressure and damages the heart and liver. This can weaken vessels in the brain, leading to hemorrhagic stroke or increase clotting risk. Cap 8. Stress and poor lifestyle. Chronic stress, poor diet, and lack of sleep can increase blood pressure and inflammation. Over time, this damages blood vessels, raising the risk of stroke. Cap 9. Age. As we get older, blood vessels become less flexible and more fragile. This makes older people more likely to have strokes from blockages or vessel ruptures. Cap 10. Family history or genetics. If close family members have had strokes, you may inherit weak blood vessels or clotting tendencies. This increases your lifetime risk of having a stroke. By understanding these factors, you can take steps to reduce your risk of stroke, no matter your age or background. But regardless of these risk factors, there are simple ways we can prevent stroke. Let me explain 10 practical steps you can take and how to do each one to reduce your risk. Keycap 1. Control your blood pressure. Regularly check your blood pressure and keep it within a healthy range. Take prescribed medication if needed, reduce salt in your diet, and avoid excessive stress, because high blood pressure is the main cause of stroke. Keycap 2. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins. Reduce oily, fried, and processed foods to keep your blood vessels clean and prevent clots. Keycap 3. Exercise regularly. Engage in at least 30 minutes of moderate exercise like walking, jogging, or cycling most days. Physical activity helps lower blood pressure, reduce weight, and improve heart and brain health. Keycap 4. Maintain a healthy weight. Being overweight increases the risk of diabetes, high blood pressure, and high cholesterol. Eat balanced meals and stay active to keep your weight in a healthy range. Keycap 5. Avoid smoking. Quit smoking completely. Smoking damages blood vessels and increases clotting, which raises the risk of both ischemic and hemorrhagic strokes. Keycap 6. Limit alcohol consumption. Drink moderately or not at all. Excess alcohol raises blood pressure, weakens blood vessels, and increases the risk of stroke. Keycap 7. Control diabetes. Keep your blood sugar in check by monitoring levels, taking prescribed medication, and eating healthy. High sugar damages blood vessels and increases stroke risk. Keycap 8. Manage stress. Practice relaxation techniques like meditation, deep breathing, or yoga. Chronic stress can raise blood pressure and trigger unhealthy habits, which increase stroke risk. Keycap 9. Get regular health checkups. Visit your doctor to monitor blood pressure, cholesterol, heart health, and diabetes. Early detection and treatment of health issues can prevent strokes before they happen. Keycap 10. Stay informed and act fast. Learn the signs of stroke: face drooping, arm weakness, speech difficulty. If you notice symptoms in yourself or someone else, seek medical help immediately, because quick action saves lives and reduces long-term damage. By following these simple steps consistently, you can greatly reduce your risk of stroke and protect your health. But for people who are already affected by stroke, which happens to many people around the world, there are ways to manage it, improve recovery, and still enjoy a healthy and fulfilling life. Keycap 1. Seek immediate and ongoing medical care. Even after the initial stroke, it's vital to continue follow-ups with your doctor or neurologist. Take prescribed medications consistently, such as blood thinners or blood pressure drugs, to prevent another stroke and reduce complications. Regular checkups also help monitor your progress and adjust treatment as needed. Keycap 2. Engage in rehabilitation, physiotherapy, and occupational therapy. Stroke can affect movement, balance, and coordination. Working with a physiotherapist helps regain strength and mobility, while occupational therapy teaches strategies to perform daily activities independently. Consistent therapy, even at home, improves recovery and reduces disability. Keycap 3. Maintain a brain-healthy diet. Focus on foods that reduce inflammation and support blood vessel health, like fruits, vegetables, whole grains, fish, and nuts. Avoid excessive salt, sugar, and fried foods. A proper diet helps manage blood pressure, cholesterol, and blood sugar, which are critical for preventing another stroke. Keycap 4. Stay active within your abilities. Exercise, even gentle activity like walking or stretching, improves circulation, muscle strength, and mood. Work with your therapist to design a safe exercise routine that matches your ability, helping you regain independence and enjoy daily life. Keycap 5. Prioritize mental health and social support. Stroke survivors often face depression, anxiety, or frustration due to changes in their abilities. Stay connected with family, friends, or support groups, and consider counseling if needed. Positive mental health, relaxation, and strong social support boost recovery, motivation, and overall quality of life. Remember, having a stroke does not mean the end of a healthy, fulfilling life. With proper care, therapy, a healthy lifestyle, and support, stroke survivors can continue to enjoy life fully and prevent future stroke. Stroke is a serious condition, but the good news is that most strokes are preventable. And even those who have experienced one can still recover and enjoy a healthy life. Remember the key points we discussed today: know the types of stroke, understand the causes, practice prevention, and follow proper care if already affected. If you found this video helpful, please like, share, and comment below. Your engagement helps others learn these life-saving tips too. Don't forget to subscribe to Health Tips and hit the notification bell so you never miss important health advice. Stay healthy, take care of yourself, and share this knowledge. It could save a life.